I'm here with my beautiful patient and we're doing perioral rejuvenation for her. So specifically, we're going to even out the cheekbones. Everyone's got their shorter, wider side and their longer, thinner side. So we're going to augment the right side predominantly to help balance that, and that's normal to use differential amounts of filler in the face. Once we do that, we're going to see that these folds don't look as pronounced, but we're going to augment them as well, the nasolabial folds, with some hyaluronic acid filler. And we're going to top everything off with a little bit of a subtle lip augmentation just to hydrate and balance out her face. As an adjunct, I'm going to add a little bit of filler also to straighten the jawline and the chin. But our focus is going to be on this area for her. Okay, so we're going to start by marking your face, and you're just going to look straight ahead. And marking the malar fat pad, zygomatic eminence over here, and then most importantly, your right side. And we're gonna build this out to match. The nasolabial folds I don't typically mark because you can already see the natural line or crease that we have there. So I've marked where they are, and then I'm gonna adjust this one to make it a little bit higher, and also change the trajectory a little bit to better match her right side. I always like to start with cheek augmentation first. I think that's the foundation of the central portion of the face. And then oftentimes in doing that, we see nice changes around the tear trough area, as well as the nasolabial fold and marionette lines. So here we go. We're gonna start by augmenting her right side, build some volume. All these fillers have lidocaine in them too, and so another reason that it's nice to start with the cheeks is it will get you a partial block of V2, which will make the nasolabial fold injection experience nicer for your patients as well. Cheekbone injections deep, close to the bone. We want her face and soft tissues to move freely over them in the gliding plane. And already what a difference you can see between the left and the right side. So I'm still gonna add a little bit to her left side just for balancing purposes, but the majority we're gonna put on her right side to balance. Then I like to wipe the marks away and take a look at everything without that distractor and make sure that we've corrected everything appropriately. And I love that for you. I think it looks really pretty. And I'll show you at the end. I'm gonna add a little bit more to the back of your cheekbone here. So it's a common myth that filler in this area will lift the face, and it clearly does. It's a great volumizer and it's a plumper, but what it is doing is it's changing where the light strikes the face. So you can see that now where her light reflex is higher, and so it gives the illusion of that nice V shape. Thank you. And already, not down here, but in this area, you can see that the nasolabial fold looks softer, even though we haven't put anything there yet. So I'm gonna start with a little bit of an injection of this thicker filler at the piriform aperture. Deep, because of the angular artery that's there. The angular artery is superficial in that area. And now we're gonna work along the nasolabial fold. And you can keep your eyes open, you can close them, whatever feels comfortable to you. Always moving my needle, that will keep you out of trouble almost always. And always paying close attention to the tissues, making sure you don't see any sudden blanching or anything that might indicate that you've injected into a blood vessel. For deeper lines, sometimes it's helpful to cross hatch along them. That may lead to more bruising because it's more injection points, but it can be a powerful technique for deeper rhytids in that area. And we're gonna really try to build this oral commissure. Filler deep into the pre-jowl sulcus. Blending that razor edge, I like to pinch and massage across it. And we're trying to smooth this area. Again, it's a camouflage maneuver. We all have a jowl that's there because that's a ligamentous attachment, but if we fill out where it's indented, it makes it less noticeable. Okay. And go ahead and close your mouth. Okay, so this is a great example of showing the right side is complete, the left side is untreated, and you can see again, just by volumizing conservatively these areas, she still looks natural. Even babies have a nasolabial fold, but they don't have a marionette line. And by augmenting the cheek, plumping this up, softening this area, filling in the pre-jowl sulcus, and ever so slightly bringing out the chin, we've straightened everything and removed those shadows that make us look older. If you look on this side, we haven't addressed that, and you can see how different she looks on the right than the left. All very subtle, all very natural. You just look like a fresher version of yourself on the right, and then we're gonna go ahead and complete the process on the left side. So injecting superficially into the marionette line, and drawing up to support the oral commissure. And I always like to start with the nasolabial folds, injecting along them, and in deeper ones, I'll do some cross-hatching to help pop them out. I like to inject retrograde. That way I know I'm delivering a smooth, even line of filler. And I'm always moving the needle, which is important from a safety perspective. Just a little bit in the pre-jowl sulcus here, and then we're gonna check to make sure your cheekbones are even, and then it's happy swelling, happy bruising, and then you look great in a week.
Oh.
No, you look great instantaneously, but you just need a little bit of time for everything to kind of settle into place. I'm gonna add even more right there. And then we're gonna do, that looks really nice. We're gonna do just a little bit of a lip for you. All right. Lips are always the fun part. What I call a smile reset. Smile really big. Show me your teeth. Really big. Okay, relax. And the fencing technique's gonna be important for her because we want to build some more structure to the height of the lip so that we see more of it, especially on the top. Because as time goes on, we lose the collagen, we lose the structure and support. And what happens is a lot of the lip likes to turn inward on itself. So you have lip, it's just hiding, as we like to say. And we're gonna build a little bit of height here. So I'm starting at the bottom of the upper lip on the wet vermilion and then building height upwards. Then we're gonna massage that after. Okay, smile really big. To make sure we have a nice natural takeoff to the upper lip. Smile really big, really, really big. Okay, relax. I'm gonna do a little bit more on the edges. Smile really big again. Stay right there. Stay right there. And close. Okay, and I think that looks really nice, so we're gonna leave that there. So we completed our perioral rejuvenation, including cheeks and jawline and a little lip, which looks really beautiful. And what you can see is just how fresh everything looks. We've got volume back. It looks, hyaluronic acid brings in the fluid in your body. It draws in water, and so it gives that very plump, luscious look. Still looks professional, still looks very natural, and that's so important when you're doing these treatments. It should not stand out. It should just allow her beautiful features to come through. So what we see is more symmetry in the cheekbones, a lifted light reflex to create that nice V shape or heart-shaped face. The nasolabial folds are softened, the marionette is softened. We've straightened the front of the jawline, and we've got a beautiful lip shape, Cupid's bow highlight, and nice defined filtral columns. What do you think?
I think it's amazing. I love it.
I think you look amazing.